Acute stress is the most common form of stress. It comes from demands and pressures of the recent past and anticipated demands and pressures of the near future. Acute stress is thrilling and exciting in small doses, but too much is exhausting. Overdoing on short-term stress can lead to psychological distress, tension headaches, upset stomach, and other symptoms. Fortunately, acute stress symptoms are recognized by most people. It's a laundry list of what has gone awry in their lives: the auto accident that crumpled their car fender, the loss of an important contract, a deadline they're rushing to meet, their child's occasional problems at school, and so on. Because it is short term, acute stress doesn't have enough time to do the extensive damage associated with long term stress. The most common symptoms are emotional distress, some combination of anger or irritability, anxiety, and depression, the three stress emotions. Muscular problems including tension headache, back pain, jaw pain, and the muscular tensions that lead to pulled muscles and tendon and ligament problems. Stomach, gut, and bowel problems such as heartburn, acid stomach, flatulence, diarrhea, constipation, and irritable bowel syndrome. Transient overarousal can lead to elevation in blood pressure, rapid heartbeat, sweaty palms, heart palpitation, dizziness, migraine headaches, cold hands or feet, shortness of breath, and chest pain. Acute stress can crop up in anyone's life, and it is highly treatable and manageable. These are people who suffer acute stress frequently, whose lives are so disordered that they are studies in chaos and crisis. They are always in a rush, but always late. If something can go wrong, it does. They take on too much time, have too many irons on the fire, and can't organize the slew of self-inflicted demands and pressures clamoring for their attention. They seem perpetually in the clutches of acute stress. It is common for people with acute stress reactions to be over-aroused, short-tempered, irritable, anxious, and tense. Often, they describe themselves as having a lot of nervous energy. Always in a hurry, they tend to be abrupt, and sometimes their irritability comes across as hostility. Interpersonal relationships deteriorate rapidly when others respond with real hostility. The workplace becomes a very stressful place for them. The cardiac prong is similar to an extreme case of episodic acute stress. The people facing episodic acute stress may have an excessive competitive drive, aggressiveness, impatience, and a harrowing sense of time urgency. In addition, there is a free-floating but well-rationalized form of hostility, and almost always a deep-seated insecurity. Such personality characteristics would seem to create frequent episodes of acute stress, and they are much more likely to develop coronary heart disease. Another form of episodic acute stress comes from ceaseless worry. Worrywarts see disaster around every corner and pessimistically forecast catastrophe in every situation. The world is a dangerous, unrewarding, punitive place where something awful is always about to happen. These awfulizers also tend to be over-aroused and tense, but are more anxious and depressed than angry and hostile. The symptoms of episodic acute stress are the symptoms of extended over-arousal, persistent tension headaches, migraines, hypertension, chest pain, and heart disease. Treating episodic acute stress requires intervention on a number of levels, generally requiring professional help, which may take many months. Often, lifestyle and personality issues are so ingrained and habitual with these individuals that they see nothing wrong with the way that they conduct their lives. They blame their woes on other people and external events. Frequently, they see their lifestyle, their patterns of interacting with others, and their ways of perceiving the world as part and parcel of who and what they are. Sufferers can be fiercely resistant to change. Only the promise of relief from pain and discomfort of their symptoms can keep them in treatment and on track in their recovery program. While acute stress can be thrilling and exciting, chronic stress is not. This is the grinding stress that wears people away, day after day, year after year. Chronic stress destroys bodies, minds, and lives. It wreaks havoc through long-term attrition. Chronic stress comes when a person never sees a way out of a miserable situation. It's the stress of unrelenting demands and pressures for seemingly interminable periods of time. With no hope, the individual gives up searching for solutions. Some chronic stresses stem from traumatic early childhood experiences that become internalized and remain forever painful and present. Some experiences profoundly affect personality. A view of the world or a belief system is created that causes unending stress for the individual. For example, the world is a threatening place, people will find out you're a pretender, you must be perfect at all times. When personality or deep-seated convictions and beliefs must be reformulated, recovery requires active self-examination, often with professional help. The worst aspect of chronic stress is that people get used to it. They forget it's there. People are immediately aware of acute stress because it's new. They ignore chronic stress because it's old, familiar, and sometimes almost comfortable. Chronic stress kills through suicide, violence, heart attack, stroke, and perhaps even cancer. People wear down to a final, fatal breakdown. Because physical and mental resources are depleted through long-term attrition, the symptoms of chronic stress are difficult to treat and may require extended medical as well as behavioral treatment and stress management.